Hello, everyone. This is our April 6th briefing. I'd like to start off today, and I don't know of anything that could be more important, but I've just been notified of an additional death, but we have our third and fourth deaths in West Virginia now. And while they're pacing significantly below all the other states and surely significantly below the national average, it's sad and it's not good enough, but you know, we just have to deal with it. We know that this pandemic is really rough stuff, and that's why we urge all of you in every way to stay the course, because it's truly devastating. So for those families and those individuals, I again ask all of us as West Virginians to join Kathy and I, as we think about them in prayer and know that we just hate it and we miss them. And so, I really don't know what else to say, about that. Over the weekend, we did do 2 more executive orders, emergency orders. The last time I spoke with you on Friday, we had a clustering that basically a hotspot in Berkeley and Jefferson County primarily, but Morgan County, was right on the, tips of this and really asked to join those 2 counties. Since that time, we also had more hot spots that came to our attention over the weekend. And on Saturday night, throughout the day on Saturday, we discussed, what was going on. We evaluated over and over and over with our medical experts, with the National Guard, and with all the people that are involved from our side. At 9:30 on Saturday night, or 9:45 on Saturday night, I issued another executive order that was basically bringing the counties of Monongahela, Harrison, and Kanawha County into the fold with Berkeley, Jefferson, and Morgan County. In those counties, we are limiting, and I'm going to read this to you, we're limiting groups to a maximum of 5 people. We're directing all businesses to require employees to work from home to the maximum extent possible. We're directing the local health departments to establish the maximum occupancy of and proper social distancing within essential businesses, and taking action and this is really important, and taking action to enforce these health regulations. I'm directing the West Virginia National Guard to provide logistical support and services to assist county agencies. The National Guard is not to do law enforcement. The National Guard is to assist, and by assist, I mean everything that they can possibly do to help in every way, all of our county agencies, all the way from going to get groceries for people or whatever it may be. And I'm directing the West Virginia State Police to assist with enforcement of local county orders. We've got to stay at home. We've got to listen, and we've got to take heed to everything we're doing. It's working, and it's working fabulously in the state of West Virginia, but we've got to know over and over, I say the same thing. We're the most elderly state. We're the most chronic illness state. We're the highest risk state of all, and we're within a rock's throw of all these populations where people are dying like flies. Now, you've got to listen, and we've got to stay the course. The storm is either close upon us, or in some places it's even looking like it's fading away. We're close. We're close. Please stay the course. Also, we have an issue. We've had an issue. It came to me in 2 different questions, one on Thursday and one on Friday. And to just tell it like it is, I went immediately to my people and I said, listen, I'm sick and tired of hearing about this because I don't know any other way to say it. We were not processing or answering the phone as prudently with all of our unemployment claims that are coming in. Our people are doing great work. They're overcome by the number of claims, just like it's happening all across our nation. There's a federal website or whatever that we've got to go through that mechanism to get everything plugged in. That was the bottleneck. But what I did is, I basically, Brian Abraham was there, and Brian that day, being a guardsman, he was dressed in his uniform, and I said, I want you to tell General Hoyer that whatever we think is adequate that workforce is soliciting from the Guard, do 3 times that. because we've got to get these unemployment claims out, and we've got to get people that are looking to find a way to pay their utility bills or whatever. We got to get them satisfied, and we got to get them taken care of, because they got enough on their mind, scared to death about the health of them or their families or their grandparents or whatever it may be. So I am happy to report right now that we now at Workforce West Virginia have the equivalency of, we're moving toward having the equivalency of 3 call centers, and by that we're spread out. We're not going to all cluster together, but we now have the operating capability of going 24/7. So we should get these claims taken care of and the phones answered and your questions taken care of as well. Now, also, on Friday, about, probably 2 or 3 or 4 o'clock in the day, we got our federal disaster declaration from the federal government, which was a really good thing. And I thank President Trump and his whole team. We had made the request, and it got out in an expedited fashion. And this basically triggers the release of Fed funds to help our communities recover from this virus and this terrible pandemic. I'd also like to report at this time that we have had a positive, a person test positive that was an employee of Workforce West Virginia. The DHHR and the National Guard are staying in close communication with the Kanawha Charleston Health Department in their investigation. The employee is isolated now at home. The call center, has not been impacted by this situation. And General Hoyer will give you more details on this measure in just a few minutes. I've got just a couple more things. At the Eastbrook Center Nursing Home, there was an individual that just tested positive there, and the Charleston Area Medical Center has agreed to administer all the tests to all the patients and employees at Eastbrook, and they'll do that beginning today. And the last thing I would tell you is just this, and I want to go over this for just 1 second with you, and that is that take heed again and again and again to everything everybody's saying. Wash your hands. I've got a little bit of a runny nose and everything, and you see me, with a handkerchief and everything, and I've washed my hands 18,000 times today, and I'm going to keep on doing exactly that, and I'm only exaggerating to make the point. But with all that being said, please keep your social distancing. For those 6 counties that I mentioned, and they were Jefferson, Berkeley, Morgan, Monongahela, Harrison, and Kanawha counties, just stay with me on this just 1 second. They represent right at 60% of the total positive cases that we have in this state. They're true hotspots, and we need to stay right dead on top of this, and that's what we're trying to do. I will promise you that overreaction will never hurt us. It may inconvenience us, but it will never hurt us. And the ability to save one life is worth every bit of overreacting and going at this as aggressively as we possibly can, and that's what we're trying to do. When we get a hot spot, we're going to stay right on it, and we're going to act as aggressively as possible to make sure that we save as many lives as we possibly can. Now, in conclusion, I just want to bring up something that has come either through our DHHR, or has come to us from the federal government. But just listen to this. For those out there that were concerned about, are we taking enough tests? Are we testing enough? And this is all prorated on your population, your total population versus your total population of the other states. It's the only way that it can be done in an appropriate manner. But West Virginia, per its population, has tested point, well, and I want to get this straight. It's tested 0.049 of its population. Virginia is tested 0.274. West Virginia, remember, is 49. That's the easiest way because I may be off a digit, on what I'm reporting to you. But West Virginia is at 49 on the testing. Virginia's at 27. Pennsylvania's at 60. Ohio's at 37. Maryland is at 46 and Kentucky at 41. So basically, the bottom line of the whole thing is per the population percentage of those states that I read, Kentucky, Maryland, Ohio, Pennsylvania, Virginia, and West Virginia, we are second in those states as far as the number tested to the population percentage. Now, with that, Kentucky's positive percentage is 21%, or 21. Maryland was 59, Ohio 34, Pennsylvania 90, Virginia 31, and West Virginia 18. So the number of tested, we're the second highest of all those states, and for the number of positive per tested, we're first, the lowest. And so I commend all West Virginians again and again. You're doing great stuff. We're staying ahead. We're staying ahead with a population that is the highest risk. We're staying ahead. Stay the course. Please stay the course. If we stay the course, we hope and pray we don't have long to go. And if we can stay the course, good things will happen. So I commend you and I thank you in every way, and God bless.
Thank you, Governor. We're now going to take comments from a few of our panel members. Up first, Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's great to be with everybody this afternoon. And the governor has shared a lot of the good news that we have received here over the last few days. But I think that let me take pause for just a second to talk about the prediction ratings, the numbers that we're getting back from the University of Washington's prediction model, and also about the work of our citizens. So we know that prediction models have many limitations. They are only as good as the information that's fed to them, and they're very dynamic. So as the information changes that is fed to them, so do the models. And in fact, little differences in what is put in can lead to big differences on the other side of the models. And what we know about fighting this COVID-19 and winning is the fact that our power is to starve this virus. The virus really lives and thrives on person-to-person contact. And there's a measure called the R0 or R0, which basically reflects how infective the virus is. So the influenza virus, every person that's infected infects about 1.2 to 1.6 people. So the R0 is about 1.6. The COVID virus infects, one person infected infects about 2.5 to 3 people. So the R0 is much higher, which means that the COVID virus can amplify very quickly. And we've talked about that in 2 months, one person with the appropriate doubling time of the COVID virus can infect 1,000 people. In 4 months, one person can infect 1 million people. In 6 months, a person can infect 1 billion people. So that's the compounding benefit to the virus. But we also have a compounding benefit that allows us to fight the virus, and that is doing exactly what most of our citizens are doing. Staying at home, staying apart, protecting yourself, because it's not just you protecting yourself, it's you protecting your family members, your vulnerable people in your community, our healthcare workers, our first responders, and we are doing a great job at that. So by reducing that infectivity ratio from 2.5 to 3 down below 1, which is what I believe that these activities will allow us to do, then we starve off the virus and the virus goes away and we win. And so the model that the University of Washington has published and updated recently suggests that we're doing a good job. The max time that we will see our little surge, it looks like by this model, has moved up from May 4th to April 15th. The number of people they project will die in West Virginia has gone down from about 500 to around 150, 170, as I remember. And a number of our parameters around critical care beds and that kind of thing looks really good. But this model is only as good as the information that is currently being fed into it. And so that means that we are doing a great job as a state. And people should feel good about that. And for us, we are incredibly grateful and indebted to each person who is doing this to protect themselves and their family and their community and our state. But it's not time to become complacent. It's not time to turn back and say, oh, we're good. In fact, this is a time that we know doubling down really helps. And as we learn from California and New York, on March 16th, New York and California had the same number of COVID positive people. California went on a stay-at-home, very strict. New York didn't. In 8 days, New York had 15,000 people that were COVID positive. San Francisco had 1,000. And we also know from the China experience, a single day of really doubling down can reduce the number of COVID positive people by 40% in 12 days. So West Virginia, we are doing great. It's time to do even better. And the governor has talked about the executive orders, and those are important. But let's just say that the really important thing is the personal responsibility of every person in our state to do the right thing, and to do the right thing not just for themselves, but do the right thing for their family members, for their community, for their state, for our first responders. And I think the way that we're going and the community that we have around social distancing, 6 feet away, staying at home, protecting yourself, don't put your hands to your mouth or your face or your eyes, wash your hands frequently, is making a huge difference. You've heard that from the governor, but I would implore you not to be satisfied with this, because things could change very quickly. And if we stay together and we stay connected spiritually, morally, socially, but not physically, in the state of West Virginia around this particular issue, then we absolutely will be the beacon for the rest of the country. And we're doing it. And we're winning. And it's time for us to continue that commitment. So thank you very much for everything you're doing. And I will turn it back over to other people on the panel to comment. Thank you.
Thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 493 National Guard personnel on duty. Just to highlight some of the key components of what the governor has tasked us to do today at Eastbrook Center, along with CAMC, Kanawha Charleston Health Department, and Charleston Ambulance Authority. Over 125 personnel and staff were tested in a couple-hour period to address the issue at that location. In addition, as was pointed out by the governor, we had one potential positive at the workforce office with Kanawha Charleston Health Department and our epidemiology teams at the state supporting the Kanawha Charleston Health Department. It was determined that one individual would need to be isolated. We've also put in some preventive measures to help ensure the safety of all staff and personnel. That includes taking temperatures as well as surveillance questions. In addition to the activities there for workforce, as was pointed out by the governor, 15 National Guard personnel are supporting the efforts at workforce along with other agencies to go to a 24/7 call center, and then also over this week also improve the number of personnel who will be able to process claims. those are all working effectively at this time, and our citizens should start to see improvements over the next couple of days. In addition, as the governor pointed out on Saturday, in consultation with his leadership team, we provided additional surge capacity to Kanawha County and are prepared to provide additional surge capacity to Mon County as well as to Berkeley County. That comes in the form of additional training for businesses and retail establishments that are considered critical, as well as providing support to additional epidemiology assistance to the county health department, as well as logistic support where it may be needed. Again, it's important to point out that increased staffing is supporting those locations as well as Workforce West Virginia to address the directives that the governor's laid out for us. In addition, I think it's important for us to understand that we continue to work methods to help improve our PPE posture. One of the things that started today at Charleston Area Medical Center is a method being used to sanitize N95 masks. We have another method that we're awaiting final FDA approval on. And in the case of these methods, it would allow us to sanitize over 20 different times N95 masks to improve our availability of PPE for our frontline workers. All things that are being done to help innovate and make sure that we meet the demands that we may have over the next several days. Thank you.
Thank you, General. Up next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and our State Health Officer, Dr. Kathy Slim.
Good afternoon. As Clay mentioned, we're doing the right things. Our citizens, you out in our communities are doing what needs to be done to slow the spread of this virus. And as the governor said, we must keep the course. We must stay the course. I want to remind everyone that as they social distance to protect your physical health, take care of your mental health as well. On our www.coronavirus.wv.gov website, we've added some additional tabs. We've added under the behavioral health tab, guidance on stress and coping, providing tips there for reducing stress for parents and caregivers, children, and our responders. We've also added a tab, updated guidance under the public tab. So we have information for non-healthcare settings on that tab. We've added under the travel tab some guidance for hotels, motels, and other lodging facilities in the state, preventive actions there for hotel workers and information on out-of-state travelers and more. DHHR is a large agency. We have a lot of services that we are continuing. Even though we're in the middle of a pandemic, we have our folks working from home where possible. We want to be available. We want to be accessible to anyone who needs us in the community. So I want to mention again that if you need services, our almost all of the services provided at DHHR can be accessed under wvpath.org. That's wvpath.org. And also your Family Resource Network in counties, that is at wvfrn.com. So either one of those websites can lead you to individuals that can help you with questions. Our local offices are trying to work from home as well, but contact numbers should still be available there. So be safe, take care of your families, and thank you all for what you're doing to help.
Thanks. I was asked to speak a little more to the data, especially the data that's on our dashboard now, the updated dashboard. And so I wanted to kind of talk to that, and then I think we're going to go through some slides to look at that. But I think first it's important to note that there are a couple of priorities with data. There's the priority both of accuracy and the priority of speed, and they are important at different levels in different ways. So at the state level, DHHR is the official reporting agency for COVID-19, which in turn, we provide that data not only for our own use in the state, but also for the U.S. Centers for Disease Control and Prevention and all of our national numbers. So at the state level, accuracy is really the absolute priority. It's important to note that that data is informed by the local investigations that occur. So you may see that the data that comes in shifts slightly. For example, laboratories may come in, or a hospital may report an individual coming from one county, but the investigation shows that they actually reside in a different county. So that gets updated and corrected each time that the data gets resubmitted from the local to the state. So I think that's just important to know that the data at the state level continues to get more and more accurate each time that it is updated. And but there's often a day or two lag time between when that occurs at the local level and when it gets to the state level. At the local level, speed is more important. And so that's where you often will see local reports being publicly available before the state. And the state will actually, you'll find the same, that the state data will be updated before the national data for West Virginia is updated. So this is just part of the routine system to be aware of that and know that. We also think hospitalizations are a piece that we'd like to be reporting on as well shortly. And so we are working with a variety of folks on how to do that. I want to make sure that people realize that every data point we collect takes time and effort of someone on the front lines. And so we want to really thank all those healthcare workers, hospitals, local health departments that collect this data and put it into the systems that we can then report it out. So we do have some of that data. We are working to make sure it's provided to you in a clear and understandable way with that. Let's walk through the actual dashboard. So on here, you see the front of the dashboard, and it has the same numbers you've been seeing. So on the left is the 345 laboratory confirmed positive cases that we've been reported to at the state. Then you have the number of deaths that we've seen, the number of total individuals that we have received, or the number of reports that we have received from laboratory results. And then the cumulative percent positive, which is what we are following, that people have talked about, that 3 to 4%. It really varies over time. We want to keep that steady. So on each of these numbers, you've got some information below that you can click to get more information on. So if we click on that one on the left, the 345, we'll go to the next slide. And here you actually have some more information related to the confirmed cases in West Virginia. So you have the map on the left. And if you hover over each of those counties, you can see that the number of cases that are in that county. And then the counties with a gray are ones where we have not yet identified a positive case. That does not mean that the virus may not be there. People need to be doing all the same precaution measures there, just as they have anywhere else across the state. But it just has not identified a positive case in a resident from that jurisdiction. But we have well over half of our counties, I think 30 some counties now, that we have identified positive cases in. So that's the map, and it gives you the sense of where numbers are and by county. Some of those may be related to outbreaks in facilities. Some may be related to community level transmission. On the right-hand side, you see on the top, this is the kind of the cumulative number of laboratory confirmed cases. And you can see that is increasing over time, which is what we've been, each time we report out more cases, that column goes up, it's by day. And we're actually tracking those by the data specimen collection, because that actually gives us the most accurate time frame which they are diagnosed there. You will notice that it levels off at the very end, those last few, and that is because some laboratories take longer than others to get their results back. And so those numbers increase in completeness based on when the laboratory gets their numbers back to us and what their turnaround time is. Everybody's working very hard to make sure as fast as possible those labs get things done. It is a challenge across the nation with that. The bottom, you see two different charts, the one on the left actually looks at the age distribution. So what age are people that are our laboratory confirmed cases? So you will see on the right-hand side, those last two bars, that actually reflects our 60 to 69-year-olds and our 70-plus-year-olds. So about 34% today, about a third essentially of our cases, our confirmed cases, are over the age of 60. In the middle, you see that by decade, the number of our percent of our cases that are in each of those categories. So if you look at our 20 to 59-year-olds, 62% of our confirmed cases are in that age group there. And then if you look at the under 20, which is the left two columns, that actually reflects that only about 3% of our cases are under the age of 20. So this mirrors the national data that this is really an illness that is occurring mostly in adults, and that it is across that adult lifespan. We know that those that have higher risk factors or are older are at higher risk of poor outcomes with that. On the right-hand side there, the circle, that's the breakdown by gender. And so we have about 53% of our cases reported to date are female, and 45% or so, 46% are male with that. And so that's the breakdown by gender. So this is the page that looks at our confirmed cases and what the demographics of those are. If we go to the next slide, this is the third page on the dashboard, and this is actually looking at the test results that we have received. And I want to, before we even jump into this, we're looking at, as you can see, that we've received test results on, or essentially almost 10,000 test results. This actually is underreported in terms of there are more tests that have been done. We get the positives of those, but not every laboratory can report them to us electronically, and so of the negatives. And so this is actually an underreporting of the tests results that have been done through the system, through the state. But it is what we can track electronically with that. So on the left-hand side, what you see is the age breakdown of individuals tested, those test results. So what you see essentially there is that testing is being done across the adult lifespan. And then you've got some testing done at the younger ages as well, but that's about 8% have been under 20. And those would be based on the symptoms and those types of things for the testing. The right-hand graph there looks at the cumulative number of laboratory results reported to DHHR. And so that you see is showing that we have of increasing numbers of testing going on. And you see a leveling off at the end of those last few bars. And that again is because there are some labs that have longer turnaround times than others. And so we might have a few more days before some labs get their tests done and get the reports sent to us. Once they get the tests done, they report them to us very quickly. But that's just that leveling off is just reflecting the lag time of some labs being longer turnaround times than others. And then the last slide here is looking at the cumulative percent of positive lab results to date. And this is the number that Dr. Marsh and the governor and others have been tracking and that we compare to some other jurisdictions as well. And this simply reflects the percent of all of the tests done on that date, the percent of all the tests done cumulatively, what percent are positive. And we map this actually out by the date of specimen collection here so that it's clear. So this is the number that we keep following with that as well. We also look at the daily rate. That is actually quite variable because it's a smaller number, but we look at that for trends as well. But the one that we can look at systematically across is this cumulative percent of positive lab results to date, and that's what we're all watching carefully there. The last area that I would speak to is just, I think, to reiterate the importance of the measures that people are putting in place. As you heard, the projections are actually improving in terms of what our peak might look like. And although it may come sooner than we originally were thinking, the projections are now suggesting that it will not be quite as severe. That being said, it will get worse before it gets better. So we would expect to continue to see rises in cases and rises in deaths, sadly. And so it just reiterates the importance, the critical importance of the social distancing, the being physically distant from each other, that frequent hand washing, the surface cleaning, and then now we've added the use of cloth face coverings in many settings. So I think that is just important that we keep doing that. We can give some practical examples of that. I mean, the one I'll share today in terms of simple things that make a difference is, for instance, with your grocery shopping, if you can limit that to, say, once a week to minimize the times you need to leave the house, you can limit that to one family member, and think about using online ordering and pickup if that's available, or delivery if that's available in your community. Those are a key kind of simple tip with those. Many of us, I think, want to kind of loosen those social distancing restrictions a little bit, and because it's difficult, especially when the weather is nice, we'd ask you, please do not. We've got to have everyone really stay strong and keep doing your part to flatten that curve. It's okay to do things like, if you are going to go out, take a walk with your dog and you're on your own and can do that physical distancing, that's absolutely fine. So it's okay to do those things outside without masks, without other kinds of things. But we just want to make sure that people truly do adhere to those recommendations that are being made by your local health departments, that businesses really do operate along these lines that maintain physical distance with individuals, and that everyone respects that. If you do have any symptoms, cold-like symptoms or illness, please do stay home. Do not go out. People who have symptoms do not always need to be tested, but you do need to take those precautions to stay home and manage your illness, and then call your healthcare provider if you are needing to get some assistance with that. Please do call first before you visit a healthcare provider. I'm going to stop there, and we will go to questions.
Okay, thank you, Dr. Slimp. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation as well. The first questioner today will be Taylor.
Second, bring it back to me just 1 second. I want to. Before we go to the media and the questions, I'd like to just, Dr. Slimp's given us a lot of information, and I want to kind of, concise it, and one thing I'd like to show you is, Jordan, if you could put up, I don't think you can put this up, I'm sorry, but put up the dashboard as of today, please. And if you'll notice on the dashboard today, we have 345 positives, 9,940 tests taken, and a 3.47 positive per test taken. Okay, if you could take that down now, Jordan. This morning at 10 o'clock, and that's after 10 o'clock, that's today's results, but as of 10 o'clock this morning, we had 324 positive and 8838 total tests for a 3.67 positive per total test. Now, the shockingly bad thing is just this, is one death is too many, and we have 4 now, and we don't want to overlook that in any way. But we have dropped from 3.67 to 3.45, and of those, the increase from 324 positives as of yesterday to 345 as of today is an increase in positives by 21, with slightly over 1,100 tests taken. And if you equate that into a percentage, that equates to right at 2%. So if we're tracking at 3.47 now versus 3.67 yesterday, and the number of tests we took in today was at 2%, that's good stuff. Now, and it's showing a lot of hope. Now, I continue to stress that the hope can turn ugly really, really quickly. Now, but on a national basis, the other states are tracking at a level of about 8 to 10%, and we're still tracking now at 3.47, with the results that came in today at right at 2%. So we're tracking significantly below all the rest of the states. And if you think about New York, which is the epicenter of everything right now, they're still tracking at 30 to 50% of tests taken to positives. And so the net of the whole thing is we're tracking well. And that's why I said over and over and over to all West Virginians, and I've got one more graph that I want to show you, and I won't bore you with a whole lot of stuff, but Jordan, if you could put this graph up real quick. Basically what this graph is the states, and I guess it's the 14 states, the 14 states that are 37th to 51st, and that's basically a territory, I guess, beyond the 50th state. But those states ranked from 37th to 51st. Now, you want to be last in this deal and everything, but we are almost tracking just exactly with Montana. And Montana came in 51st, and we came in 50th. So again, we're holding the numbers, and we're holding where we want to. And if you'll look at that curve that shoots straight up, that curve that shoots straight up is New Jersey. And all those states that are down on the lower level are the states that were from 37th to 51st. Now, and I may have misspoke when I said Montana, because that state that is slightly higher than us is Minnesota, not Montana. I mean slightly, they're 51st and we're 50th. But the only reason I wanted to go through that is Dr. Slimp has given you tons of information. Their dashboard is phenomenal now. She's doing great work, as well as Secretary Crouch. They put it out now to where it's really easy to track and it's easy to see. But for me, as you were saying that, I just thought I could bring a little more clarity to that.
Okay, thank you, Governor. The first media questioner today will be Taylor Stuck with the Herald-Dispatch. Taylor, are you with us?
Hi, it's Taylor with the Herald-Dispatch. I was wondering if you could tell me, or someone could tell me, what the surge will look like in real time. Like, what will that look like for West Virginians, do you think? And what would be the indication that we're moving out of that surge? And what will be the indication that we can maybe start going back to some normalcy?
Well, maybe, Governor, okay, if I take the first shot at that?
No, Clay, that's good.
Thank you. So I think that, Taylor, it's a great question. We're hoping to avoid a real surge, and what we would look at would be, an increased number of emergency room visits. We would look at a uptick in the number of positive tests, which is the reason why I think the governor acted very decisively in executing the further executive orders for the 3 areas of our state, because it starts in the community, it goes through the emergency rooms, and then it goes into the ICUs. And we are tracking very carefully emergency room visits and looking at those for increases, and particularly the areas of our state that we see the increased amount of positive testing. And then, of course, we look at intensive care unit capacity, look at how busy they are, how many people are on ventilators, and we're doing that in a way to keep track of the part of our system that fails fastest if we get the surge. We hope and we believe that because of the good work of our citizens and some of the decisions that the governor's made and that local health officials as well as DHR's made, that we are able to prevent us from having that surge, which really is the overtaking of the capacity of the health system. And we believe then that if we can get through this first part, which the Washington model predicts will happen mid-April, then we will start to see an opportunity for us to understand then what are those next phases. Because if we get through this effectively, which we believe that we will with the good work of our citizens and their commitment, but then a lot of people will still not be immune to this virus, and then we'll have to figure out what the next phase looks like.
And let me follow up. I want to say one thing real quick. The surge, and God forbid, we saw what the surge could do in Italy. And we've seen what the surge can do in New York and other places across this country. You know, whether big or small, the surge can be devastating beyond all comprehension. It's my job. It's my job to try with all in me to see that we're either ready or we some way, somehow prevent that from happening. You saw over and over bodies being loaded onto freezer trucks in New York City. And it's bad stuff. And you saw last night our president come out and give us what he said was, you know, just a glimpse of light, of hope, that this thing was beginning to turn. You've seen us shrink down when we thought really the surge was going to come till April 15th now, you know, and you've seen us reduce down from what looked like 500 people could die in West Virginia to 150 or 175. I can't recall exactly the number. Can you just imagine 150 or 175 West Virginians dying? If we can avoid that, and it could have been way, way, way more catastrophic than that. 4 is too many. 150 or 175 would be just terrible. So let's please just stay the course. We're going the right way here.
Thank you. Up next, let's go to Charles Young with WV News.
Hi, this is Charles with WV News. My question is for Dr. Marsh and probably General Hoyer. Could you talk about what the updated modeling means for our preparedness in terms of supplies, PPE, that sort of thing? It sounds like, you know, we're going to need less than we had anticipated up until recently, but we're going to need it sooner. Could you guys address that for me?
Sure. Jim, do you mind if I start?
No, sure. I mean, you and General Hoyer handle it. You know about the supplies we got over the weekend and all that stuff.
Great. Thank you, Governor. So Charles, good question. We have been able to create some more time that has really been through the actions of our policies and our citizens. So we have been planning, and I'm confident that we are ready for any surge that happens. Certainly, we have tried to become self-sufficient, as well as working with the federal government in having sufficient personal protective equipment, and also come up with ways to produce our own personal protective equipment and decontaminate that we're using. We also have a very novel plan for PPE that we will announce soon, which I think will be very exciting. When it comes to having other supplies and availability of capacity, we've been working closely with the hospital associations, with the hospitals, with the extended care groups, so that we can release bottlenecks in hospitals, and also with some approaches to be able to help people stay in their homes if indeed they do get sick with the COVID virus. So I think that we are in relatively good shape. You can never be completely prepared for something that you don't exactly know what's going to follow, but we have paid strict attention to the models. We have done, I think, a really good job internally together in creating the best plans for capacity and for resourcing so that we are acting as a state, not a separate set of hospitals and entities. So, Jim?
Yeah, Charles, just to highlight a couple of things Dr. Marsh and the governor talked about. So one of the things we did early on is the governor authorized us to buy the reusable PPE, the system we refer to as the PAPR system. Also in our hospitals, they have a little bit different system called the CAPR system that's also a reusable system, and those are working with that. We work towards the what we call the sanitation or decontamination of critical mass like the N95 and working multiple sources. And then the other key point is the governor directed us early on to stand up a task force to look for multiple sources of supply. This is just like a military operation overseas. You don't rely on one supply stream. You work on multiple sources of supply. So a number of different private supply chains, as well as the system that is out there with FEMA to be able to manage that. We also now look at the proposed burn rate per day in our state versus the models. And as we continue to do the things that we do, and I guess the last thing I would reinforce again from the 6,400 guardsmen, those on the front lines, our medical folks, our first responders, law enforcement, if we can double down now, and we can double down in those counties of Kanawha, Monongalia, and Berkeley County, where we have our highest numbers, we have a great opportunity to really even flatten this curve even more, which will be great for us as the state of West Virginia. So we've got to space out in these stores. We've got to do those things that we're asking, because that's the equivalent of PPE and reducing our burn rate on those things we need for the surge.
Okay, thank you, Charles. Up next, we'll go to WVVA, and I believe Jackie is with us.
Yeah, Jackie Swigert, WVVA here. Hey, all. I think this question would be best for Dr. Marsh or Secretary Crouch. What is the process for contact tracing positive patients in West Virginia?
Hear the question, if it was coming to me. I'm sorry.
What's the process for contact tracing positive patients?
I could not hear.
To that, that's all.
I believe her question was, what is the process for contact tracing in West Virginia?
Kathy, maybe you could.
I'd be happy to. So when a case is positive or is reported, that goes to the local health department immediately, and they begin a case investigation. And they have the support of both a regional epidemiologist and some National Guard that have also been trained in this process to support them as needed with that. So they do an initial interview, and gather everything they can gather around the individual person who has been, we know, is positive. They then identify and talk to them or whoever they can speak to, the family and others, to identify who they would have been in close contact with from 48 hours before their illness began up until the present, or when they would have been self-isolating or whatever the issue was. So they identify the individuals who would be in close contact, and that really means like living in the same household, being within 6 feet for more than 10 minutes with someone, sharing utensils, those kinds of very close contact. They identify those individuals, and then they go to those individuals and work with each of them to determine who else needs to be tested. Does anybody have symptoms? Who needs to be isolating themselves? Or actually, it's to explain some language, the person that is sick, anyone who is sick isolates themselves. Those who are well but have been exposed do a self-imposed quarantine, and that's the 14 days. So they work with each case to work through that, to figure out what contacts need what kind of follow-up. And that's all part of that epi investigation.
Okay, thank you. Up next, let's go to Katie Coyne with the Charleston Gazette-Mail.
Hi, Katie Coyne, Gazette-Mail. Governor, can you speak a little bit, looking at the enforcement piece of these extended orders, what are state police officers allowed to do, what are they not allowed to do, and what's being done to ensure that there aren't abuses of power with these broad new responsibilities?
I'm really sorry. I can't hear. General, can you hear? I mean, maybe.
Yes, sir, Governor. The question was, what is being done related to the enforcement issues and the use of the state police to help with the enforcement powers of the executive order and the ability of the local health departments to take action?
I got it now. The bottom line is just this: the health department people are urged to call if they see someone, if they see people that are gathering in a crowd, and they see things that are going on as far that is adverse to our social distancing. We're encouraging them or empowering them and encouraging them to call their local officials as well as the state police. And then the state police or the local authorities are going to come and they're going to tell these people that they've got to disperse, they have to social distance, and if they refuse to do so, they can charge them with obstruction.
Okay, thanks. Up next, let's go to Amanda Barron with WSAZ. Looks like Amanda.
Hi there, Amanda Barron, WSAZ. Oh, can you hear me?
Yes, we got you. Go ahead. We have you, Amanda. Go
Jordan,
ahead.
can you hear me? Okay, cool. I wanted to ask Governor about the unemployment benefits. I know that obviously today is the first day that the National Guard is participating and helping get the systems running up 24/7, but there are so many people out there right now who are panicked about paying their bills. What is your plan? Is there any kind of a plan to help people in the short term? Also, Delegate Andrew Robinson sent a letter, I know, to you today about potentially deferring weekly benefit calculations and determining chargeability back to specific employers. I know that's a lot at once, but there are a lot of people, wondering what they're going to do as far as bills are concerned.
Okay, Amanda, I think we've already done exactly what the delegate was requesting, but I'd like for Brian Abraham to, if he could just step up here and, maybe with that mic, you could, maybe Brian could add a little color to that.
So Amanda, last week, the governor, 2 weeks ago actually, as we began to stand this up, the governor had already ordered that every impediment to unemployment insurance be waived. So employers were not going to be charged their normal experience factor. The employees would not have to wait the week to get their unemployment. So everything that could be waived and still comply with federal law, the governor directed that, and he signed that into an order for the director to do.
And Amanda, I think another part of your question was, with manning, workforce 24/7 and doing all the things we're doing to try to process the claims as expediently as we possibly can and get everybody, be able to get everybody their dollars and as quickly as possible. And we've amped that up in a great big way. And we're going to get that done. But Brian, hold on just one second. There was another part of the question is, can we as a state step in and do something about the backlog or reinforce the backlog? And maybe you could comment on that.
The way to fix the backlog is to add the manpower the governor's directed. We have that operation going to be going 24/7. We've added staff. We're going to add processors to it, not just those that answer the phone calls. So we're reducing the backlog day by day. We're in constant contact with the director of workforce to ensure that they have all the resources they need. The governor is constantly contacting us and making sure we're pushing them in every way, shape we can. We are bringing in the staff, the National Guard, some other agencies to supplement those call centers. So we're putting every resource we can to it. The only issue that we're still trying to find a technology fix on, and that is the federal portal for which we have to push all the claims through. The governor mentioned that earlier, but we continue to have our OT work on that as well.
Okay, thank you. Up next, let's go to Casey Gentile with WVNS.
Hi, this is Casey Gentile from WVNS. Just curious if there are any plans in the future to add recoveries to the DHHR website.
Okay, Bill, maybe you could do that.
I couldn't quite understand the question, Governor.
Adding recoveries to the website.
We are looking at adding a variety of components there as we move forward. As you've seen, what's been done over the past week or so, the website is much improved. We're looking at those metrics that might be important for the public, it might be important for others to see. So it will change over time.
Okay, thank you. Next, let's go to Brad McElhenney with West Virginia Metro News.
Hi, Governor and everyone. We've talked about the importance of the people at Workforce West Virginia helping people process their unemployment claims, but this presumed positive test of an employee of Workforce makes me wonder what the work conditions are there. With such urgency to process those claims, are the employees able to social distance the way the rest of us are trying to do?
Governor, if you want, I can take that and Dr. Schlemp could help. So Brad, they already were practicing the appropriate social distancing. That was one of the reasons that the Kanawha Charleston Health Department director decided that only one individual needed to be isolated in the event that you just described. There is also separation by floors, and part of the plan that the governor's directed that the National Guard and other agencies help with both the call center and the processing is a distributed system across the state. As Brian Abraham mentioned, one of the issues that we've got to manage with that is the technology to distribute and roll phone numbers and things of that nature. But I think the good news is that because of what was being done, it limited the exposure with the one individual. This morning, National Guard medical personnel also added an extra layer with taking temperatures as well as doing some surveillance questions. And I think Dr. Schlemp may be able to speak to how all those things come into play to help us keep our workforce safe.
Sure. My understanding actually is that they were doing a great job. The call center had really taken very seriously this issue. The leadership had really taken seriously keeping their staff safe. So they had spaced their employees. They had taken lots of good precautions to protect them. And that was a real benefit in the investigation because it was clear that the work that they had done had limited any kind of exposures in the work setting. The close contact that you heard referenced was not a work setting contact. And so they've done well with this.
Okay, thank you. Up next, let's go to Stephen Allen Adams with Ogden.
Yes, Stephen Adams, Ogden Newspapers here. And my question's a little bit related to the unemployment issues with Workforce West Virginia. I've been asked about the pandemic unemployment assistance, the program for the self-employed. I understand that the Workforce website basically kind of has we'll let you know when it's ready type of web page, landing page. But when exactly, do we have a timeline for when that's going to be made available for self-employed?
Yeah, I can take that. Stephen, as I understand it right now, I think we're still waiting on the guidelines from the federal government in regard to that. You know, I think what they have promised is they're trying to roll that out on Wednesday or Thursday of this week. You know, in regard to the independent contractors and the self-employed, but I think that's who we're waiting on that.
Okay, thanks. Stephen. Up next, let's go to Kenny Bass with WCHS.
Hi, this is Ken Bass from Camp Lake, Fox 11 in Charleston. I have a question for Secretary Crouch. Specifically, we've gotten several calls from state institutions from across West Virginia, but focusing on the William R. Sharp Hospital, reports that the screening process for patients and for workers has changed multiple times in the past several days, that people on the floor are working with fevers or others are symptomatic, and also that Sharp is not getting the PPE equipment like some other places are not. Is it possible, I know that you guys have said you have policies and procedures in place, but is it possible that with the policies and procedures in place, there's some type of noise between you and the people on the front lines, the supervisors? Either they're not getting the proper instruction or they're not paying attention to the proper instruction because maybe they're shorthanded or maybe they're used to doing things a certain way.
Wait a minute, Bill, before you answer, let me do this, Kenny. Let me defend, the great work that Secretary Crouch and Dr. Slimp and the National Guard, all the people that are underpinning this whole effort are doing, because let me just tell you this, that we are screaming from the hilltops to have people follow guidelines, and those guidelines are the safest guidelines that we know about today. But you and I both know, you've seen people going to Walmart, or you see people doing this and everything. We absolutely have to have people on the honor system and people following the guidelines. I'm sure, now Bill, you can take it from there, but I do want to speak up for the great work and the tireless work that these people are doing. It's not good enough, don't get me wrong. We don't rest until it's over, but at the same time, people got to listen. People got to listen on the other end too.
Thank you, Governor. Kenny, we have a process where we take everyone's temperature before they enter the building. There's actually a questionnaire that we ask daily when folks come in if they've been in contact with someone who's COVID positive, whether they've been in an area that has a cluster. The temperatures that we use are actually a little more restrictive than CDC guidelines. So we follow CDC guidelines and then take that a little step further. So we certainly don't want anyone in our buildings who have a fever and who have symptoms. We ask them to go home immediately and self-quarantine if that happens. We test folks that come through our facilities. So we're very serious about this. Obviously, we're not going to be successful at this if we allow folks who might be positive or might have symptoms to be in our buildings taking care of other folks. So we take this very seriously. We've heard the same rumors in the private sector. I've had hospital administrators contact me with the exact same complaint. So I'm not sure where this is coming from, but again, we're very careful about that and we're serious about it.
Okay, thank you. Up next, let's go to Mark Curtis with WOWK.
A couple things here. First of all, the governor, I guess you tweeted over the weekend something about changing or relaxing nursing requirements being adjusted, some appeal you made to the nursing board, if you could address that. And also, of the 345 cases so far, how many of them are considered to have been recovered now, the people recovered?
Okay, the last half of the question, Mark, we're definitely going to have to go, to Bill Crouch and Dr. Slimp. The first half of the question, I couldn't quite hear it, but it was something in regard to the nursing board, and maybe, Bill, you can just take them both.
I'm sorry, Governor, I couldn't hear the first part or the second part. Kathy, did you hear that? We get very poor audio reception here, sorry. Can somebody repeat the question to us?
This is Clay. So I think the two questions were that the governor tweeted over the weekend about relaxing some of the restrictions from the nursing board for surge issues. And then also the second part, I'm actually forgetting, unfortunately. Recovery, that's it.
345, how many are recovered?
Well, there are a lot of boards and a lot of federal requirements and regulations that are being relaxed in this pandemic. And the reason for that is simply that it's a pandemic. We have a serious situation in which we need to have all hands on deck. We're looking at utilizing nursing students in some cases, medical students from WVU to assist in investigations. So we're really looking hard here at all of the resources on the table that we need to make sure we get through this as unscathed as possible. The governor set us up by making all of these decisions early on, in some instances before we even had a positive case. So the federal government has come along and said they're going to relax some of the requirements as well. So those are temporary. Those are during the emergency period only, but you will see a lot of those that are relaxed. In terms of the recovery, Kathy, do you want to address that?
Sure. This is a really fascinating question, actually, and a challenging one. We have to recognize that there is a wide array of duration and timeframes that people have before they are recovered from this disease, depending on their own conditions, et cetera, and exactly what is the definition of recovery. And so if someone who has minimal to no symptoms, it may be a few days. They may not even realize they had the disease. For several folks, it will be a week or two. And then you've got individuals who really have long-term ongoing both challenges and disease and complications from that. There are some models that look at that, and many of the projections on Hopkins and other sites are based on some of the modeling kind of things. We're looking at what we can do to do that and estimate here. You would have to actually do a call down of every individual person and define exactly what's meant by recovered to get an actual percent exactly of these. So we're looking at what we can do to in the interim get a sense of that, but it is not as straightforward a question as one would like to think. And it really does have to look at how this disease takes part across population and how we can best project that.
Okay, thank you, Governor. I'll turn it back to you.
Well, I'll just end real quickly and just say just this, that it is natural. It is natural for all of us that have never seen anything like this pandemic to think, well, it can't happen to me. This isn't going to happen to me. But in that makes us lackadaisical in heeding the advice of the medical community and the medical experts, as well as our National Guard. Please keep the faith and stay the course and keep doing the things that we're trying to tell you to do. It's working, but we still got a long ways to go. Thank you so much.